So we spoke about sepsis a lot, but that was basically in our microbiology days, you know. So we spoke about sepsis so much. So right now we still want to now talk about another concept of sepsis, but this is now related to gynecology. This is sepsis in pregnancy. All right. So sepsis is when an infection gets into your bloodstream and is now spread into, all right, a wide range of your body. So for sepsis, it's also sepsis in pregnancy is also known as maternal sepsis. It's a life-threatening condition. It's usually triggered by the body's extreme response to an infection. All right. So the woman had the infection when she was pregnant, or the infections came in when she was giving birth, or after that period of giving birth when she's fragile, she's vulnerable, there are wounds everywhere, the infection came in. Do you understand? So it's a major cause of what? Women dying, okay, worldwide, okay. And for you to be able to spot a pregnant woman with sepsis is a thing, all right. So that's why we discuss this concept. So what causes it? What will make a woman have an infection during pregnancy? Okay, so infections that are pregnancy related, like postpartum endometritis. Your endometrium is becoming inflamed after you gave birth. Infected cesarean sections or episiotomy wounds. Right? They did any of those pregnancy procedures and there are wounds, and the wounds are not properly taken care of, so infections are setting in. You had a miscarriage or abortion complication, prolonged rupture of membranes. So the amniotic sac has ruptured. That's what we call the broken water. Okay, and they left it for a very long time. It's just leaking out without any proper care. It could be a very good fertile ground for infections to set in. Mastitis, that's breast infections. There's sometimes you could have infections that are unrelated to pregnancy, like she had urinary tract infections, pneumonia. She has COVID-19. All right, this COVID-19 or any other infections that will weaken your immune system. So if your immune system is weak, it's when those pathogens now have a free ground to now be spreading anyhow. So common pathogens that will usually cause a pregnancy infection include things like uterine. Infection source could be from the uterus or wound. Things like Escherichia coli, group B streptococcus, could be urinary tract infections. So things like from Escherichia coli, Proteus, Klebsiella. Then bloodstream infections like Staphylococcus aureus, Listeria. Okay. So symptoms to watch out for include things like fever. So fever is more than the blood pressure, the temperature is more than 38.3 degrees Celsius. Okay, or sometimes fever can cause your body temperature to crash. Rather, your heart rate is so fast. Okay, you are breathing so fast. You are confused. Altered mental status. Low urine output. You're having fever and chills, muscle pain, extreme fatigue. You are discharging some things on the vagina and it's foul smelling. Okay, diagnosis and monitoring is blood test, because you want to now pick up all those inflammatory indicators. We do urine swabs, wound swabs, vaginal swab. You send it to the lab. This is because you want to dictate the type of microorganism that is causing it. Imaging, all right, this one you want to actually look at the structural stuffs. Then continuous monitoring of the mother and the baby. Treatment approach is what? Use antibiotics to tackle it. Okay, then that the person has lost a lot of fluid, so you replace fluid. Okay, oxygen therapy. Okay, if they are finding it difficult to breathe, just like you saw in the symptoms. Vasopressors in severe cases. Early delivery. Okay, if fetal risk is so high,